Hey guys, hello. How are you? I hope everybody is doing wonderful. This is your girl Grace. So, in today's video, I wanted to talk to you guys about what is the difference between a healthcare support worker and a physiotherapist assistant. What are the differences between a healthcare support worker, physiotherapy assistant, or rehab assistant? So in all honesty, before we go on, right now, I just like to bring information to let you know that at the moment, the United Kingdom is giving documents, visa, tier 2 sponsorship visa for senior care assistants or physiotherapy assistants or occupational therapy assistant or highly skilled immigrants. So if you don't know about this scheme, I really want you to take advantage. Go to www.uk.gov and do a lot of research in finding out on how you can bring yourself here to the United Kingdom. The journey is not for the faint-hearted. You have to be consistent. You have to know that this is what you want. You have to be willing to put in the work so that you can find yourself here and we can have a party together. So, like I was saying, I wanted to talk to you guys about the differences between a healthcare assistant and a physiotherapy assistant. So, the one major similarity is that a healthcare assistant or physiotherapy assistant, they both help patients. They both help patients. Healthcare assistant, physiotherapy assistant, both of them, they help patients. They help patients. So the difference is that healthcare assistants mainly work with nurses. So they help the patients with activities of daily living like their washing and their dressing, toileting, bathing needs. They also help the patients with maybe like medication reviews and those kind of things. But the healthcare assistants mainly, they also are known as nursing assistants and they also work alongside nurses. But not saying that healthcare assistants also cannot work with like physiotherapists, but mainly healthcare assistants are known as nursing assistants. They would do so many things like taking blood pressure of the patient, making sure that the patient has taken their medication and their drugs. So, on the other hand, we have the physiotherapy assistants. So, physiotherapy assistants are specifically assistants for physiotherapists or occupational therapists. And the physiotherapy assistants, they actually help the physiotherapists and occupational therapists to do things like, for example, if a patient has a stroke and the patient is not able to walk properly, but the physiotherapy wants to do a walking practice with the patient. So, in this aspect, the physiotherapy assistant would normally help the physiotherapist, assist the physiotherapist to mobilize the patient. Another role of the physiotherapy assistant is maybe a patient has been seen by a physiotherapist and the patient has been given exercises to complete by the physiotherapist. The role of the physiotherapy assistant is now to help observe and monitor the patient while they're doing their exercises to make sure that the patient is completing their exercises very well. Another job of the physiotherapy assistant is to help the physiotherapist in the gym where they do things like cleaning, like putting equipment. They might be able to measure a patient for an equipment like a walking stick or walking frame, or they might also take the patient to the physiotherapy gym before the physiotherapy arrives. So the role of a physiotherapy assistant and that of a healthcare assistant is a little bit similar because they help patients, but also very specific because the healthcare assistant mainly supports and helps the nurses, and the physiotherapy assistant mainly supports and helps the physiotherapist or occupational therapist. But nevertheless, physiotherapists and occupational physiotherapy assistants and healthcare assistants are so invaluable to the medical team. As a healthcare assistant or physiotherapy assistant, know that you are a very valuable member of the healthcare team. You are a very, very important member, because sometimes even before the nurse or even before the physiotherapist sees the patient, you are the person that the patient might confide things in. For example, if the physiotherapist is going to do a maneuver with the patient might be telling you, oh, I haven't taken my blood pressure tablets, or oh, I didn't have a good night's sleep. And then it will be your job to communicate back to the physiotherapist, oh, this patient is not feeling so well today, or they really felt sick overnight, or something like that. So that means the physiotherapist will now be able to modify their treatment, or they might not even go ahead and complete the treatment at the time. So you are a lifesaver as a healthcare assistant or a physiotherapy assistant. You are a great, great value to any physiotherapy team, and you are needed right now. So if you're looking to come to the United Kingdom to live and to work as a healthcare assistant, a senior healthcare assistant, a physiotherapy assistant, or a physiotherapist, I hope this video has helped to give you a bit of encouragement and confidence to know that you are a very valuable member to the team. I like to help people, encourage people, motivate and empower people. If you need any guidance with like your resume, if you need help with like finding jobs and those kind of things, feel free to leave me comments in the comment section in this video. And make sure if you have any questions, just ask away and I'll see if I can answer or be of any guide to you. I hope you have a great day. Your girl, Grace.